Cognitive Behavioral Therapy, CBT. Founder, Dr. Aaron Beck. Dr. Aaron Beck's biography can be found on the Aaron T. Beck Psychopathology Research Center website. Dr. Beck is the founder of cognitive therapy, which is also known as cognitive behavioral therapy, CBT. Beck's interest in human behavior spans his lifetime, and after graduating from Brown University in 1942 and Yale Medical School in 1946, he did a residency in psychiatry at Cushing Veterans Administration Hospital. His experience in long-term psychotherapy came from Austin Riggs Center in Stockbridge. During the Korean War, Beck became the assistant chief of neuropsychiatry at Valley Forge Animal Hospital. In 1954, he joined the University of Pennsylvania, where he still serves as Professor Emeritus of Psychiatry. He also serves as the President Emeritus of the Beck Institute, which is a worldwide resource for CBT. Beck is a prolific researcher and writer with over 580 articles and 24 books published. History of CBT. Dr. Aaron Beck developed cognitive behavior therapy in the 1960s. When practicing psychotherapy, he noticed that during sessions, his patients were having conversations within their own minds regarding what was happening in the session or what reactions might be occurring due to their behaviors. Beck soon realized that the key to change was leading the patient by changing harmful thought patterns, which in turn led to developing positive behaviors. Beck called this therapy cognitive therapy because of the focus on what the patient was thinking. Eventually, the terminology was changed to cognitive behavioral therapy. A YouTube video in this presentation shows Dr. Beck discussing cognitive restructuring in CBT.
Honor.
Application of the theory. CBT has shown great success in the treatment of depression, generalized anxiety disorder, panic disorder, post-traumatic stress disorder, social phobia, childhood depression, schizophrenia, and bulimia. CBT has also been moderately successful at treating anorexia nervosa, chronic fatigue syndrome, hypochondriasis, gastrointestinal problems, and depression associated with other medical disorders. Major tenets of CBT. It emphasizes the present, based on current thinking and problematic behaviors, including situations, perceptions, events, and patterns that lead to the feelings. It requires a relationship of trust with the counselor and emphasizes teamwork with the therapist and active participation, including homework. It is goal-oriented and problem-focused. Sessions are structured and limited to 6 to 14 sessions. It uses a variety of techniques to change thinking, mood, and behavior. It educates the patient to cope by using learned strategies and emphasizes relapse prevention. The techniques. CBT uses talk therapy to recognize thinking patterns that are shaping present behaviors. In 16 to 14 structured sessions, 5 areas are explored. The situation. The therapist asks questions in order to comprehend present situations. Thoughts. The therapist works with the patient to recognize negative thoughts that are altering perceptions. Physical feelings. Learning awareness of physical symptoms might be warning signs of the onset of emotions, thoughts, or feelings that lead to the behavioral problems. Emotions. The technique creates an understanding of how thought patterns can influence emotions and how patients can take control of thoughts and feelings. Behaviors. Understanding the power of thinking helps patients respond with new, more positive behaviors by purposefully turning negative self-talk into new ways of coping. References: an article by Judith Beck from 2011, The Basic Principles of Cognitive Behavior Therapy. Aaron T. Beck Psychopathology Research Center. An article retrieved from their website. Beck, Andrew, from the Beck Institute for Cognitive Behavioral Therapy. The YouTube video featuring Dr. Beck, Restructuring in CBT, and The Canyon, Guide to CBT.